So you do bone grafting right there in your office. I mean, who's a candidate for that, and what's that like?
Yeah, what's interesting with the new treatment options that we have, often we don't even need to graft. There are a lot of people who come into my office who've been told before that they have too little bone and that they need to undergo all these massive procedures that are really scary sounding in order to get dental implants. And often with new treatment options, we can avoid those. But sometimes there really isn't enough and we have to graft it. What we find though with methods that I employ is that it's really tolerable, and I tell my patients, hey, it's just going to increase your treatment time a little bit, because usually we have to let the graft integrate before we then proceed to the next step.
So are you kind of squirting like bone building material into the socket, or what
you kind of are.
Okay.
That's a great description, actually. If we graft on the day of extraction, which is the most straightforward and also most inexpensive way to graft, then we take the tooth out, we have the socket, the hole in the mouth, and then I do squirt the bone graft material in there, and then I put a membrane over it to cover it so it doesn't fall back out, and then we let it heal for a couple of months before we proceed. Sometimes patients have been missing the teeth for a long time, and especially when they wear dentures that push on the gums, the bone recedes. So then we have to employ grafting to recapture what was there.
But this is not a painful procedure or something they complain about?
No, it's not. So first of all, when we do it, of course, I'll get you nice and numb so that you don't feel a thing. And then afterwards, just like with extractions or other work, we want to counteract swelling, because swelling can be painful. But as long as we control that, then it's really tolerable. I call my patients the next day to just check in with them next day or two, and they report that they're doing well and that they're surprised. Most people are really surprised with how little discomfort they feel. And every once in a while I get this comment, man, if I would have known this, I would have done this 10 years ago. Which
is that right? Okay.
It's too bad that they held back, but finally they're getting it done.
And we should mention, I mean, you teach other doctors.
I do.
What we're talking about today. Is that right? I mean, you're here in San Diego lecturing.
That's right. That's right. I really enjoy teaching. So there are only so many procedures I can do myself, and enabling other dentists to do these treatments is very rewarding, because I can reach a lot more patients. And there are so many out there who are missing teeth. Did you know that there are 178 million Americans who are missing at least one functional tooth?
No.
That's half of the US population. So people are missing teeth all around. If you meet 10 people on the street, chances are you saw several that have missing teeth. So there's a big need in our country to replace teeth.
So you have a bias. I mean, you're board certified in implant dentistry. Do you believe that if you're going to find a dentist to do this, is that what you do? You ask them, are you board certified in implant dentistry?
You can do that. You can certainly do that. I have people who seek me out because I'm board certified.
You can go on the website. It doesn't cost more to go to a person like you, right?
No, it does not. It's one of those few things where you get somebody who is an expert at it, but not charging different fees.
And it might be less getting it done right the first time.
Well, you sure hope so.
Yeah.